Hello, my name is Sadie Holt and I work in the Bowerman Sports Science Center. My project investigated the renal hemodynamic response to oral protein loading during prolonged mild hypohydration. Hypohydration is a state of low body water, and it can be the result of inadequate fluid consumption or from sweating during a heat event. The literature says that the kidneys can control body water through a few different mechanisms, primarily by changing blood flow, but it's not known if a state of mild hypohydration affects the regulation of renal blood flow. Renal blood flow can be increased with an oral protein load, which alters the blood flow within 1 to 3 hours. Therefore, we tested the hypothesis that prolonged mild hypohydration attenuates oral protein loading induced increases in renal blood flow compared to a hydrated state. Preliminary analysis was done with 8 healthy subjects, including 5 females, who were randomly crossed to perform either a hypohydrated or a euhydrated trial first. The hypohydration protocol required 24 hours of fluid and high water content containing foods restriction, meaning they didn't drink any water or any liquids for 1 day before the study. The euhydrated visit involved a normal diet and fluid intake. Kidney blood velocity was measured using Doppler ultrasonography in both the renal and the segmental arteries. First, baseline kidney measurements were taken using the ultrasound, followed by the subject drinking a whey protein shake. The kidney ultrasound measurements were taken 75 and 150 minutes after protein ingestion. Moving on to our results section, data was analyzed using a paired t-test. Subject hydration level was measured using both urine-specific gravity and nude body mass. Urine-specific gravity measures the density of the liquid, with a higher value indicating a greater level of hypohydration. So we see there's a larger increase in body mass resulting from greater level of dehydration. I'm going to take a minute to orient you to these graphs here. So we have the symbols representing individual data points, with the blue bar on the left showing the mean for the euhydration trial, and the red bar on the right showing the mean for the hypohydration trial. These two graphs on the left highlight the hydration status of the subjects, and we can see with an average increase in urine-specific gravity here during hypohydration and a larger decrease in nude body mass during hypohydration. This is consistent with our expectations for the dehydration protocol. Furthermore, the two graphs on the right highlight the largest change in blood velocity from baseline measurements measured in both the renal and the segmental arteries. And that's again split into both the euhydration and the hypohydration trials. These graphs highlight that there was no significant difference in peak increase of blood velocity in either the renal or the segmental arteries between the euhydration and the hypohydration trials. Contrary to our hypothesis, these findings indicate that prolonged mild hypohydration does not alter the kidney's ability to increase renal blood velocity. Thank you for listening.